As numbers increase across Chennai, touching 7,000 every day, the Stanley Medical College Hospital in Chennai has developed what they call zero delay oxygen points. The last 2 days, they've developed 110 beds with oxygen supply so that patients who would otherwise keep waiting in their ambulances can actually come and use these beds, take the oxygen here so that they will get stabilized. And as rooms get vacated, they are gradually shifted to the beds there. In fact, they have around 1,300 beds in this hospital, including around 150 beds in the ICU. And with me, Dr. Punita. Doctor, thank you very much for your time. If you can explain how the system works, Doctor.
In the Stanley Hospital, we are having more than 1,350 inpatients, COVID positive inpatients, and more than 150 ventilated patients we have here at present. And many complaints are coming like that many ambulances are waiting in the outside, patients are waiting for long time to get the bed. To avoid that, in the Stanley Hospital, this is an outpatient area, but within 2 to 3 days we have converted this more than 100 oxygen beds. So we are continuously taking the patients from the ambulances. Patients will wait here and around 6 to 8 hours, maximum 8 hours period. Patients will be admitted to shifted to the corresponding wards, like if they need ICU care, patient will shifted to ICU and the other oxygen beds. So this is within the short period, 2 days of time, we have created more than 100 oxygen points, and we are continuously taking all the patients, so that patient we can avoid the long waiting in the ambulance, we can avoid the...
Still many are waiting. That will be?
Yeah, still many patients are waiting, but continuously we are taking the patients inside according to the bed vacancy. Many patients getting discharged inside.
Have hospitals reached their capacity, Doctor? Is there any?
Yeah, almost we have reached the capacity, but again we are creating 500 patients in another super specialty blocks, and another within another 1 or 2 days, another 500 bed super specialty building and another 300 bedded wings are getting ready, oxygen beds are getting ready, so we can take the patients continuously inside. So this is particularly meant for zero delay, so we are avoiding the waiting period of this patients in the ambulance.
And lastly, Doctor, with this kind of a facility, how much have you been able to reduce the wait time outside?
So initially here patients may wait 4 to 6 hours like that. Now we are reduced the waiting time to around 1 to 1.5 hours to 2 hours. Within 2 hours we are taking all the patients inside.
Based on that demand as well as an unexpected surge, we created a zero delay beds of nearly 600 beds here in the ground floor itself immediately without making increased waiting time for the patient on a war foot basis. In fact, in army also they do a war footing arrangements. Now we have done it exclusively day and night. The technicians, in spite of the risk of facing all the COVID-19 infection, they were working day and night.
So when they come in ambulances, what do you do?
See, immediately after coming in the ambulance, there is one exclusive team to assess the patient. When there is a segregation of the patients, where the patients can wait for some time, or the patient were in immediate admission. The patients who require an immediate admission, we immediately trolley them inside and we place them with the oxygen support, or if they require a ventilator support, we try to shift them immediately for the ICU setup. And the segregation happens in the ambulance waiting bay itself. When we feel that we can wait for some more time with the existing oxygen supply what the ambulance people having, in fact they can wait for some more time. We are providing that on a priority basis, depends on the severity as well as the clinical condition of the patient. We don't leave the patient. Once they come inside the hospital campus, we support them by all means, by taking the patient inside, or with the support. If there is some time delay is happening, we try to provide them an oxygen cylinder to maintain their status, clinical status. If they are severe, there is no waiting time at all. They will be immediately wheeled inside.
Now we see still many are waiting.
Yeah, because we have made an assessment, and based on the assessment, we try to bring them inside in a phased manner. And she is there there is an exclusive medical officer. She is in charge. Last COVID also she was a part of the system. She knows how to mobilize.
Right.
What to be given a priority, it has to be decided by our medical team. Normally for everybody will have an apprehension. I've been waiting for 4 hours. The guy who has come within half an hour, they'll be moving inside. It depends on the severity. Here there is no preference given for anybody. It is based on the patient's clinical condition. We take the patient inside.
Looking at the numbers rising every day, do you think we need a similar large-scale expansion?
Yeah, we are preparing that and we are doing it, and we have an additional beds are getting prepared for us,
Yes, sir.
and we are ready to take up the challenge, and with all your help, and we are doing it also.
Already we have 1,400 around inpatients, and now we are creating another 500 bed oxygen block here. Super specialty block is getting ready, and one more block we are also is getting ready for this handling this COVID crisis, rapid inflow of patients. So we are able to handle around 1,400 oxygen patients here. More than 150 ventilator patients are here in ICU. So on the priority basis, depends upon the severity, we are not keeping the patient anything in the outside. Immediately they have been shifted to the either oxygen beds or ICU ventilators. So our medical officer for this exclusively for this ambulance, we have one medical officer. When the ambulances come, immediately she assesses the patients. If the patient's oxygen saturation is very low, if he needs immediate ventilator care, patient has been shifted to ventilators immediately. Otherwise they will make here for another half an hour to 1 hour till they get the bed, and they will go to the corresponding wards according to that.
Thank you so much, doctors, for your time. That was
Yeah,
Dr.
this is better, I think.
Radhakrishnan and Dr. Punita talking to us about the newly established zero waiting oxygen points, zero delay oxygen points at the Stanley Medical College Hospital. With Shah Vijay in Chennai, Sam Daniel, Find the TV.